quickly decided let me try out going live all at the same time between I'm on Facebook, I'm on Instagram. Hello, Instagram people. I'm on Facebook, I'm on YouTube. I got a new computer, y'all. And this thing is like super clear. It's super close up. I'm really sorry for everyone who's seeing me so close up. But I wanted to come on and say hello. What's going on? So I've been working on foundations. It's been released. You guys can check it out. Handtherapysecrets.com. Go to Foundations of Hand Therapy, and it was one of our our programs that you can just buy, purchase it, do it on your own. I am in the works to revamp it and relaunch it a little bit just to make it really great. As I've had a chance to kind of like look through it and say like what really works for people as I'm teaching in the mentorship program, and what are people like continuously asking me for. So revamping it, I'll let you know more about it. And anyone who's already bought it, remember, if you bought it before, it's yours. When there's a revamp or an update of it, y'all people get it, right? So no extra charge. You're bonused because you got it early at a really nice price, right? So anyway, if this is your first time seeing me, if you're watching this on replay, please consider playing along. My name is Huang. I'm an occupational therapist and certified hand therapist. And what you see behind me, where I'm at, is my clinic. So my clinic, and that's where I kind of do the thing that I do, which is therapy. And it's my training grounds, my not only for my treatments, but I train different therapists, all types of therapists, and yeah. So I wanted to come on and share some quick ideas um, for you, because I know that, let's face it, one of the things that I often hear about is that it's hard to get into hand therapy. And not only is it hard to get into hand therapy, but it can be really overwhelming once you get into hand therapy, knowing what to do and how to go about doing it. So my goal always is to like, how can I help you make it easier, make it less difficult, make it less overwhelming. And that's essentially what I've done with Foundations of Hand Therapy. So if you are somebody who has been, trying to get into hand therapy, it's hard, and people keep telling you, go buy a textbook and read it, go memorize the brachial plexus. Please, I beg you, you don't actually have to do it. There's a way to get into hand therapy and provide therapy services that are so much easier to help you get started. And that's why I've created so many different frameworks, just help people critically think through things in an easier way, easier, faster, so that you can feel good. When you feel good and you feel comfortable, you're going to feel confident. I mean, it's just natural, right? If you feel good and you feel comfortable, you're going to naturally just exude more confidence. And it's going to allow you to go into a place and be able to get a job, right? You're going to go into a place and be able to interview well and say, this is what I know. This is what I know that I can do and provide in terms of therapy treatments, and get that job. And my biggest thing is once you get that job, because really getting the job is just one piece of hand therapy. Getting a job is just one piece of hand therapy. Keeping your job and feeling good about your job. So one, you can avoid the burnout, right? You can avoid burnout. Why do people get burnt out? It's because you're spending so much time trying to read, memorize, and study at such a fast pace. And really, I understand. I'm an Amazon shopper too. We want things yesterday. We want things now. We want things fast. And when it comes to developing your skills, you can either do it at a neck breaking speed, or you can do it at a really doable speed. And I recommend the doable speed, because it allows you to enjoy the journey, allows you to actually learn and not cut corners, right? Actually learn. Understanding concepts is really key. So so this month, not to digress, but this month we're going to be covering complex injuries. So in the mentorship program. So, um, for example, let's go over some examples. The one of the key things that we often see are stiff PIP joints, right? Stiff PIP joints. So if you have a fracture, or let's say you have tendon lacerations, you might end up with a really stiff PIP joint. So your patients are coming to you having maybe read some stuff up on YouTube. I actually had someone who emailed me because she saw the plaster casting video that I did. If you guys are not aware, Hand Therapy Secrets has a huge YouTube channel, and I'm always posting videos there. And I posted a video on, I think it was like how to do plaster casting for a PIP joint. And in terms of simplifying it, right? Because you can sit there and you can buy. My computer's on the textbooks right now. You can sit there and buy Rehab of the Hand, and y'all people know I love me some Rehab of the Hand. Love those textbooks, but it's really dry. It's really boring, and unless you know, it's very complex. And one way to make hand therapy easier is to simplify everything, so that once you start to do and practice, you start to get the hang of it, you start to understand the concepts. And then when you go and read the book, it makes it more simplified and more doable, right? Like, oh my God, I understand that now. So, if we're talking about a really stiff PIP joint, what are some ways that you can really work to ensure that you work to get it more supple and to get more extension, right? So one way is to just passively stretch it, right? That's one way. Now, that's one way to passively stretch it. You do it, you teach your patient to do it. Another way is to serial cast it, right? Serial casting or plaster casting. Serial casting just means you're going to cast it, and then so many days later, you're going to straighten it out and you're going to cast it again. And then they're going to come back and you're going to straighten out and you're going to cast it again, right? Plaster casting is serial casting, essentially, but done with plaster material. So it's essentially the same thing. Now, if you used casting material then it's just serial casting. But if you use plaster casting, it is essentially serial casting, but done with plaster casting. So just to kind of clear that up, so there's no confusion, they're essentially the same thing. So you do plaster casting, serial casting, to slowly but surely crank that out, right? Another technique or treatment type that you can do is a dynamic splinting. So you can make a big old hand base outrigger, pulling that into extension. You can do that. Or you can do an LMB. An LMB is the small with the springs. And I always say that that's a custom fitted dynamic orthosis too, because it's really about being able to bend the wires and being able to teach your patients to adjust it. So yes, a lot of people can order stuff online, try to do things themselves, but you as an expert, you have the ability to help them. So how do we take a really, really complex concept like, a stiff finger, and really dial it down and make it really simple, right? And that's what I do essentially in all of my programs. How do you dial it down and get it so simple that you know exactly why you're doing what you're doing and how to do it, so that you can get results? And then once you can log in those hours, right? There's no right or wrong. Like, so don't don't let anyone make you feel some kind of way about what's right or wrong. I normally like to go with simple, like Occam's razor is like, what's the simplest way of doing something? So that not only is it simple for us, but simple for our patients, right? Not, I was just reading an article, it wasn't really an article, I was just scanning it, and which talks about plaster casting and how effective that is, and how, gone are the days research is showing that static progressive for passive range of motion is not as effective. And I'm like, yeah, I get it. As a hand therapist, depending on who you are working with, um, you need to take into account that patient, right? Not everyone tolerates serial casting. Now, I cannot tell you, I used to, I don't know why, I just like didn't love I didn't love plaster casting. And I remember going to different conferences, classes of Judy Colts, who was like the person when it comes to plaster casting. And I don't know why I resisted it so much, but I did. And it was because for the kind of patients that I had, just general active range of motion, passive range of motion worked great for them. And then I started working with like really stiff hands. And then I was like, I am getting nowhere with this. Let me try plaster casting. And holy moly, right? I was starting to get results better and faster. But so it's not that you can't do it or you don't want to do it or whatever. It's that you understand the uses of it and then you apply it to the appropriate cases and the appropriate people. So, believe it or not, as research can show whatever it wants to show, it can show like this thing is amazing, but not everyone tolerates it, not everyone wants it, right? So you have to be able to talk to your patients in a way that lets them know, like, hey, this would be really great, right? And hey, sometimes you got to sell that thing that you want to do, right? So that there's compliance and that they want to do it. And then because you're able to do it and do it well, you're going to see the results. They're going to see the results, and then you have to point it out to them so that you can do it again, right? And so that's essentially like, how do you make like from everything a little bit easier for you? Like, so that's my goal in life, to make things a little easier, to make it a lot more doable. It does not need to be as complex. And I was teaching in a class, and I often hear this from different sources, students like, oh, when you get into hand therapy, like you got to go buy this book and you got to read and you got to memorize the brachial plexus. I'm like, what? Do not need to memorize the brachial plexus. Please don't try to read rehab of the hand coming starting out in hand therapy. There's absolutely no need, right? Because you're making something that's complex, you're making it even more complex. And then what happens is, a lot of times people get really deterred because they think something is wrong with them, that they are not cut out for hand therapy, or that it's so hard they don't, like it doesn't seem feasible. And it's so much more feasible as long as you're not doing, it in the wrong order. It's like trying to run a marathon, but just starting out with the marathon. It's just like, I'm gonna go hard or go home, 26 miles or bust. Right? No. Let's start with making things really simple first. Running a mile, running 2 miles, running through, a little bit at a time. So, I say, like, what can you do to put things or consolidate things into bite-sized chunks, into concepts, so that it's easy to digest, it's easy to consume, it's easy to do, it's easy to apply, so that so that you can see it's possible, right? So you can see it's possible. I think a lot of people get deterred because they see it's so hard and it doesn't need to be. And that is one of the reasons why why I developed foundations of hand therapy to start with years ago. Because when I started hiring, I was like, oh my God, there's OTs, there's PTs who are coming out and they don't know how to do the thing in the way that I teach it, like doing the evaluation. Like, yes, you might think it's like, oh, like the way I learned it in school, but in hand therapy, or oh, if you did it in a certain way in a skilled nursing facility, or you did it in acute care hospital, do you understand the concept of an evaluation? Yes, but do you need to do it in a specific way in a hand therapy clinic? Yes. When I started in a skilled nursing facility and in acute care, I never really had to do special tests. I never really had to do goniometry types of measurements. In hand therapy, you have to do it. And how do you do it in a way that's efficient, effective, fast? Time efficient, fast, that kind of stuff, so you can actually get to the actual treatment for the first visit. um Things like that. How do you break up and do an evaluation if you don't know what's going on? And I think that is some of the biggest thing. Is this being recorded? This video is being recorded. I record everything. So yeah, but there's ways in which to chunk things down. So the evaluation is, there's a framework for evaluation. So how can you think through to make it easier? So yeah, you got to put the reps in of doing the evaluation. So a little bit at a time, it'll get easier. How do you Oh, documentation, right? How do you document in a way that you're not missing anything, that you can include all the information without writing a book? Okay, efficiency is key. How do you think through like the fast track framework that I've developed? Because not all of the information comes to you on the first day. So, for example, one of my students, we're talking about complex cases right now in the mentorship program, and she sent me a case that she's having, which is a complex case, right? So do you guys know what thoracic outlet syndrome is? So thoracic outlet syndrome is basically, to just make it really simple, your brachial plexus comes down right here between your collarbone into your shoulder. It's the three nerves of your arm. Well, thoracic outlet syndrome is a compression of that group of nerves, right? Well, you can have a type of thoracic outlet syndrome, which is called a vascular type of thoracic outlet syndrome, that really compresses, and there's an injury to the arteries, the veins, and stuff like that. And people who have surgery for that, it's to save their arm, right? So if there's no blood flow, you have tissue death, right? So her case is like, there's a rib resection, there is different types of plasty, like to rebuild and to remove, and it's really complex. Now, what are you supposed to do? How are you supposed to know what is safe and what isn't safe as the therapist? And especially because sometimes the scripts that you get are not as clear as they could be. Sometimes you don't get access to the surgeons and you don't get to ask the questions. And you know what? When you do, you also want to sound like you know what you're doing. So there is a way in which to ask questions so that you're getting key information to build the relationship and the trust, right? Because you do know, it's just sometimes we need a little bit of help thinking through, like, what am I allowed to do? What is safe for me to do right now? What does this person actually need to get started on, right? Sometimes it's just the evaluation. It's just taking them from one treatment to the next treatment so that you can go home from one session to the next and say, okay, this is the problem that I saw. This is the thing that I want to work on the next time. And that essentially is the foundation of hand therapy, like knowing how to evaluate, knowing how to critically think through that first evaluation, and then knowing how to think through that treatment, which is a new framework I just introduced. So if you've purchased Foundations of Hand Therapy before, it will be included for you. Like, so we're going to be adding that. And then how do you think through what kind of treatment to do? The framework for documentation. So I've been really updating those frameworks, and it's really to get you started, to see, so that you can see what's possible for you, so you can see like all the different types of cases you potentially could be treating, and it's over time, it's over a period of time that you develop your skills, right? But you've got to want to continue putting the reps in. So so that's what we're doing. That's what we're doing. So I just wanted to come on and share some tidbits of that with you. So I was able to go through with her, like, what you're allowed to do, what you're not allowed to do, where you should get started, so you can feel really good, you can feel comfortable, and you can know that you're doing great things, and so that you're not so overwhelmed, right? It's possible. So yeah, that's what we're doing. That's what we're doing here, trying to make things that are complex into simpler ways. So Foundations of Hand Therapy, I'll be letting you know. If you're on my email list, I'll let you know. I'll come on and I'll share some stuff with you guys as well if you want to get into the action. I'm putting some additional bonus videos in there as well, because I think that when it comes to more occupational therapists going into hand therapy, so much about it is, how do I get started? How do I believe it's possible for me? I was talking to a physical therapist who's seasoned, but now they want to move into hand therapy. And remember, I said that it's not just the questions you ask, but it's who you ask it to. Sometimes you can ask it to people who don't mean to do harm, but what happens is, because they don't think that you should get into hand therapy, they might say things to deter you. So be careful with who you're asking your questions to, because if you're asking it to a person who doesn't necessarily think that you should do it, they might say, oh, whatever, maybe that's not an area for you. And it actually deterred this person from moving into hand therapy and moving into this idea of, like, I could specialize, and I could do X, Y, and Z, right? So I hear it all the time. If you're asking somebody who isn't necessarily doing the teaching all the time, or if you're asking someone who values the complexities of things, then they might tell you, go study the brachial plexus, go memorize the thing, when in actuality, you just need to know where to look and how to decipher that information, making something that's complex into something that's simple so it's doable. This is what we do for our patients, right? Don't we make things easy for them? Don't we make things easy for them to understand, right? And so we deserve that too. We deserve that too. How do you make a complex case, such as like a stiff hand, a complex thoracic outlet syndrome, a tough wrist case? How do we know it's possible? We know it's possible when we make it simple, right? Yeah. So, Occam's razor. How can we make it simple? If you are struggling today, think about how you can make it simple. I promise. I was struggling. I don't know if you know, I was struggling over the weekend working on some technology. I am so not technologically advanced. Can't even see it. And I was just making things so hard. And I was like, God, I wish there was something to make it easier. I stepped away from a little bit, but I was doing tons of video research. I was going on to their university, trying to read and watch these videos and figure it out. And it took me way too long. Took me way too long. I wish I had something simpler. But that's what I was thinking. What do I need to do to make my life easy peasy, less frustrated? And that is my goal for you. So I hope this little motivational speech, motivational conversation helped you. And I will, that's it. Talk too much. I'm done. I'm out. I gotta go. But if you are struggling to either get started or keep going, definitely leave me a comment below or send a message to my inbox. All right, direct message me. All right, and let me know what you're struggling with. I'd love to be able to give you some guidance and support to just be that voice that says it's possible, right? Okay, sounds good. Thanks for joining me, and I will talk to you next time.